Hello, in this video, we will continue our talk about ulcerative colitis. We will cover these points: colitis manifestations, disease severity, extraintestinal manifestations, and acute complications. The most common symptom of ulcerative colitis is diarrhea, which may be accompanied by blood. As a result of rectal irritation, bowel motions are frequent and small in volume. Colicky, belly pain, urgency, tenesmus, and incontinence are all associated symptoms with ulcerative colitis. Patients with mainly distal disease may have constipation accompanied by frequent discharge of blood and mucus. Symptoms normally appear gradually and progress over a period of many weeks. Symptoms may be preceded by a self-limited episode of rectal bleeding that occurred weeks or months earlier. Symptoms can range from mild disease, 4 or fewer stools per day with or without blood, to severe disease, more than 10 stools per day with severe cramping and persistent bleeding. Fever, tiredness, and weight loss are all possible systemic symptoms in patients. Iron deficiency anemia from blood loss, chronic disease-related anemia, or autoimmune hemolytic anemia can cause dyspnea and palpitations in patients. The presence and severity of systemic symptoms depends on the clinical severity of the intestinal disease. The severity of disease in patients with ulcerative colitis is important in guiding clinical management and can predict long-term outcomes. Mild disease characterized by 4 or fewer stools per day with or without blood. Mild crampy pain and tenesmus. No severe abdominal pain, profuse bleeding, fever, or weight loss. Moderate disease characterized by more than 4 bloody stools per day. Mild anemia. Low-grade fever. No severe abdominal pain or weight loss. Severe disease characterized by more than 6 bloody stools per day. Anemia. Fever. Severe abdominal pain. Weight loss. Extraintestinal manifestation of inflammatory bowel disease and ulcerative colitis include musculoskeletal, eye, skin, hepatobiliary, hematopoietic/coagulation, and pulmonary manifestation. The most common extraintestinal manifestation of IBD is the inflammation of joints, for example, ankylosing spondylitis, osteoporosis, osteopenia, and osteonecrosis. Uveitis and episcleritis are the most common ocular manifestations of IBD. Scleritis, iritis, and conjunctivitis have also been associated with IBD. Erythema nodosum and pyoderma gangrenosum are 2 of the most common skin lesions linked with IBD. IBD has been linked to primary sclerosing cholangitis, fatty liver, and autoimmune liver disease. Both venous and arterial thromboembolism are more common in patients with IBD. Airway inflammation, parenchymal lung illness, serositis, and thromboembolic disease are all pulmonary consequences of IBD, however, they are uncommon. Acute complications of ulcerative colitis include severe bleeding, fulminant colitis and toxic megacolon, perforation,